Uh, Thank you for the opportunity to be your master of ceremony and take you through the program this morning. And I think we would just love to have some introductions, especially Mr. Maposa, if you can give us on the WHO side, with the exception of the Dr.
Okay, thank you, Master of Ceremony. With me here, we've got Mr. Avonya Patrick. He's our operations officer, standing at the corner there, smiling. Yes. We have Wendy Julius, our information officer. And we have Imbayargo, she's our program assistant. Who else have I left out? Anyway? And I'm Stephen Maposa.
Okay.
Outbreak and Disaster Management Officer. Thank you.
Thank you, Mr. Maposa. Yes. And from the ministry, we have deputy directors, patrons, officers. I think the whole room. Can you stand? We want to appreciate you. The ministry directors, deputy directors. Oh, thank you. And the hospital staff. Aye. We have the media behind. And let me welcome you to the handover ceremony of the emergencies to the ministry by WHO this morning. And let me really appreciate your presence here to witness what's going to happen. And this morning, just introduce you. We have our WR who is acting then, and until then we are advised. But can we welcome our acting WR? Can we? Well, before we go that, I'm reminded the Harare City.
Yes.
Sorry for that. Harare City.
Okay, thank you very much.
Harare
We are
City.
team. I think we want one person to come.
Okay. Thank you. Thank you. Sorry for that omission. And then let's welcome our WR. The name, I'm the only one who can pronounce it properly. Dr. Juliet Nabionga. Can we welcome her, please? Let's put our hands together. And on the ministry side, we have Dr. Manangazira. Dr. Manangazira is the director EDC in the ministry, and today is 2 or 3 in 1. He's the director, he's the principal director, he's the major general again. So let's welcome him this morning. So just proceed with our program. Let me recognize your presence as the director EDC in the ministry, Dr. Posha Manangazira, just to give us an overview of the outbreak in Zimbabwe, and then some other portfolios will follow under her, with all the caps and whatever under her is going to do that. But now, as the director, can you give us an overview of what you do?
Thank you very much. Maybe I'll be seated.
Yeah.
Thank you very much, Director of Ceremony. I would like to recognize the presence of the acting WHO representative to Zimbabwe, Dr. Juliet Nabionga, and her team here present. I think you heard them being introduced. Our colleagues from the city of Harare and my own colleagues from the Ministry of Health and Child Care, represented here by deputy directors, program managers, and assistants, and our hosts, the hospital staff at Paringatwa Hospital and from other institutions, and members of the media. Thank you very much for gracing this occasion. We are in charge of the emergency preparedness and response framework for the ministry and government of Zimbabwe. And our work is usually like that. We will just say at 3 o'clock we are convening and everybody comes. So it's really in the spirit of the emergency mode that we are gathered here this morning, we are a country that has not been spared from major outbreaks of infectious diseases. When I first joined ministry in 2006, the major problem was really malaria. So when we convened the National Task Force, it was a national task force on malaria and other epidemic-prone diseases. So the others were like small print, if you like. But today the picture is upside down. We have gone in through a massive outbreak of cholera, which you know started around 2005, but really peaked in 2008 into 2009. And we had a lot of lessons that we learned from that outbreak. We also went into another massive outbreak of measles in 2010 into 2011. And again, we have done a lot of learning to the extent that we have not recorded a single measles outbreak. I think that talks to the emergency response framework of the country, but also the robustness of our surveillance system. And that has not been just by efforts of the ministry or government alone. We have all-weather partners that have always been with us, notably the World Health Organization. I'm sure you all know that we do have a long-standing memorandum of understanding with WHO dating as far back as 1980, so at independence, and that marriage is sustained. To the extent that sometimes we do have officers seconded permanently to the ministry from the World Health Organization, just to make sure that emergencies and outbreaks are well taken care of. We have gone through a number of problems since then, since those two major outbreaks, and one of them is typhoid, which started around 2010 in the capital city of the Republic. And that has refused to go away until now. And traditionally, during the rainy season, you know, we always prepare for outbreak of diarrhea or enteric diseases. And this season is no exception. So as we tighten our emergency preparedness and response for this season, we are indeed lucky that World Health Organization has come forth with emergency kits, diarrhea kits, cholera kits, among other things, just to make sure that the targeted or the hotspots can already pre-position some of the emergency response supplies, so that we are not caught napping, as has happened in the two major outbreaks that I mentioned. Finally, I would want us to appreciate that we cannot prevent diseases occurring or infections happening. But what we can do is to ensure that we pick the earliest cases and prevent secondary cases arising out of them, and put in place the requisite prevention and control measures. You will appreciate that from the kind of infrastructure and environmental and other challenges that are currently obtaining in the country, it makes it very difficult for us to say a permanent goodbye to outbreaks. So then it calls for us to always be prepared for disaster emergencies and catch them early and act on them promptly. So this is why we have to come together as government, local authorities, in this case the city of Harare, our professional staff at various levels, as well as other partners, and ensure that we are ready for the disaster emergencies. Finally, ladies and gentlemen, I would also want to remind you that we do publish a weekly report, and that really gives the full profile of our epidemic-prone conditions, as well as other issues of public health concern in the country. So, and that publication is really open and accessible to everybody who needs to get it. So that really gives you the picture of what we deal with at public health level in this country. I think I'll stop there because I see that on the program our colleagues are going to give us more in-depth into the current outbreak in the city of Harare. But thank you very much, Director of Ceremonies, for that opportunity just to talk about, you know, the global overview of outbreaks in this country. Thank you.
Thank you, Dr. Manangazira. Can you put our hands together for giving us a global overview of she says we cannot say goodbye to outbreaks, but we continually improve ourselves as we have some other interventions. And let me also introduce Dr. Ken Masota, who is from Harare's Health Department. He was not here initially, but he get by. Can we welcome him this morning? And again, he is also going to give us Harare typhoid overview. And I think everybody is now patiently waiting to hear the issues of typhoid in Harare. Overview, sir. You can
Thank you very much, Master of Ceremony. Can I start by acknowledging the Permanent Secretary in the Ministry of Health and Child Care, Major General Dr. Gwinji, represented here by Dr. Manangazira, and the Acting World Health Organization representative, Dr. Juliet Nabionga, and all those who are here present. Ladies and gentlemen, we are gathered here on an occasion where we are happy that our all-weather partner, the World Health Organization, is extending their hand of support to Zimbabweans through our government, Ministry of Health and Child Care. I think these medical emergency supplies will go a long way in helping to save lives. May I take this opportunity to remind you that we are currently experiencing a typhoid fever outbreak in Harare that started in Matapi, Mbare in October 2017. And it started when our City Health Services Directorate received a call from community leaders in Matapi that there were ill people who were in their houses, and the majority, if not all of them, had not sought medical attention in any of our facilities. On this healthy occasion, I'm elated to inform you what we've done in regards to that. Our response team responded timeously to that call and attended to all the ill residents. To date, we've managed around 2,400 cases of typhoid fever in Harare, and we've made 150 confirmations. And please be reminded that with no deaths, and this is a huge achievement. We hope that these supplies that we are going to be receiving as a government from the World Health Organization will go a long way in preserving lives in outbreaks. In this current outbreak from Matapi, males have been affected equally with females, but as in many typhoid outbreaks, fevers in the world, young children less than 15 years of age have been affected the most. Ladies and gentlemen gathered here, as Matapi and Mbare are the places where it all started. As I speak now before you, please be advised that the outbreak has spread to other areas in and around Harare, but much of the cases remain centered in the southern and western suburbs of Harare. Our achievement of note is that the number of new cases continue to decrease from the peak period of October and November 2017, through the efforts that our committed staff and partners have done. We would like to thank the government of Zimbabwe, the Ministry of Health and Child Care, which is our parent ministry as seat of Harare Health Department, the World Health Organization, and all the WASH sector partners led by UNICEF have assisted us in managing this outbreak, even though we appreciate that more still needs to be done. Accordingly, I say that the key drivers to this outbreak have been the poor water, sewer, and sanitation situation that is prevailing in most of our suburbs. It is imperative that these are dealt with as a matter of urgency. The City of Harare has set up an interdepartmental task force to deal with the key drivers of the outbreak, and this has helped to halt and reverse the increase in cases. As the Harare City Health Department, we continue to put our utmost effort in managing these outbreaks and maintaining a healthy surveillance system, which has never failed us in picking up these outbreaks, and the gesture by WHO in giving us these medical supplies will help us in managing these outbreaks. We would, however, like to move away from being managers of outbreaks to a situation where these outbreaks are proactively prevented in the first place. Our Minister of Health and Child Care, Dr. David Parrenyatwa, in many fora when talking about HIV, always talks about closing the tap and about prevention, if I may quote him. And I think it is time that we also close the tap on typhoid fever and any other infectious diseases, especially the waterborne outbreaks, and move to proactively prevent these outbreaks. I think this will help us to make more effort in managing the new elephant in the room, which is the non-communicable diseases, for example, cancer, and the increased morbidity and mortality from road carnage. Ladies and gentlemen, I would like to thank you all for the support you individually and collectively render to healthcare service provision in this country. Thank you all.
Thank you, Dr. Masunda. Now it's my pleasure to invite our WR to give us some remarks. Let's welcome him. Can we put our hands together? Where's the OO? Now Motenda. Vakuru is letting some few Shona words. Thank you.
Thank you very much, Master of Ceremony. I think I should start by saying Mangwanani.
Yes.
Is this right? Yes, the Permanent Secretary represented here by Dr. Posha Manangazera, but also in her capacity as the Director of Epidemiology and Disease Control, Dr. Masunda from the city of Harare, that's right, and other directors and deputy directors who are here, other Ministry of Health staff, and the staff from the hospital, colleagues from WHO, the media, ladies and gentlemen. I'm honored this morning to speak to you and make our donation as the World Health Organization to the Ministry of Health of reproductive and emergency health kits, emergency diarrhea disease kits, emergency trauma kits, and emergency health kits. And we make this donation to the Ministry of Health through the Permanent Secretary who is represented here. As we are all aware, disease outbreaks are not new to many African countries, but also to Zimbabwe, as the director has just explained, dating as far back as 1972, talking about the cholera outbreak and the unprecedented 2008-9 outbreak, but also several outbreaks after that, as she has ably articulated that, cholera, malaria, and other diseases. And right now, we are battling the protracted outbreak of typhoid fever in the city of Harare, mainly in the Mbare suburb, as the Dr. Masunda from the city of Harare has already mentioned. And as we speak now, we have similar outbreaks in other countries, in southern African countries. The outbreak of cholera is ongoing in Malawi, and Zambia is also struggling to contain the cholera outbreak. And what does this mean for us? That it can spill over to Zimbabwe if we are not adequately prepared to manage that. So the donation we make this morning as the World Health Organization is to support preparedness efforts, which are already underway, and a lot of work has already been done. As we speak now, we may say that the situation seems to be under control, but we should not slacken. We need to strengthen preparedness measures to make sure that transmission of cholera and any other outbreak does not come to Zimbabwe. Over and above these outbreaks that we have talked about, we know that in any emergency situation, women and girls are disproportionately affected and face multiple challenges. Among these is the inability to access essential sexual and reproductive health services, the diversion of resources to respond to the emergence at the expense of maintaining essential routine services. In addition, prevalence against women and girls, including physical abuse and sexually transmitted infections, tend to be exacerbated in cases of emergencies. We need to ensure provision of minimum sexual and reproductive health services in emergency settings. And in this vein, would like to support emergency preparedness measures with the donation of emergency reproductive health kits. And these are several. There are 12. The kits we donate this morning have sub-kits, and these can be used at the different levels of the healthcare system. Designed mainly to provide contraceptive services, treat sexually transmitted diseases, and ensure clean and safe delivery, as well as managing consequences of rape. So finally, I wish to reiterate our commitment as WHO to support the ministry in the endeavors, as the director has mentioned this morning, preparedness measures to strengthen surveillance, diagnostic capacity so we are able to detect, we are able to respond, but we also want to ensure that we are able to recover and get back to routine services and build resilience of the system to contain outbreaks and any other public health threats. I thank you so much.
Thank you, Madam Dabiara, for the support and the speech, but we will thank you more during the end of. You know, there's nothing like acting. Acting, once she signed the signature, her signature is permanent, isn't it, Ms. Mabos? It's true. So we really appreciate. Now, she was talking as the director EDC. Now she's talking as a major.
Major General.
Major General in another shoes. So Dr. Manangazira, she's representing Major General Dr. Gerald Gwinji here as a guest of honor to give us a speech. So Major General, over to you. We salute.
Thank you, Director of Ceremonies. I think the permanent secretary's shoes are easier to fill than the major ones. That one is. What comes with?
Do we do the hand? They're gonna put it.
Okay, I'm advised that the kids are already here. I thought they are over at the warehouse.
No. This is the emergency store for WHO. It was an inter-country store for WHO, but then the team has moved. Some have moved to Pretoria, some have moved to Nairobi. So the WHO office has decided that this storeroom be handed over back to the ministry, but the supplies that are in there, we are also donating them to the Ministry of Health and Child Care. The supplies that are here include reproductive health kits, emergency reproductive health kits. We have diarrhea disease kits. We have inter-agency emergency health kits, as well as trauma kits, and there's some bit of laboratory equipment and other inter-agency, more inter-agency emergency health kits. So this is the consignment. There is a room by the corner with similar supplies, but it's dark in there. We don't have to go in there, but it's same as this. So this is the consignment that is being handed over to the ministry. Thank you.
Over to you, Permanent Secretary. You want to say something?
Thank you. I think thank you very much, Mr. Maposa, for taking us through the details of what is actually contained in the full kit. So we still want to appreciate again Dr. Nabionga and her team. I think you have all seen for yourselves that we do have the emergency response supplies, which will be here, but we will also, as we said, deploy them sub-nationally to all, potentially hot spots for effective response. So thank you very much.
Thank you very much.
And Zimbabwe is in the process of preparing for an emergency donated to Zimbabwe. Maybe you can elaborate about this donation.
When we talk about preparation, we talk about many things. We talk about sensitization and educating people what they need to do, just like Dr. Posha spoke this morning. But we also prepare to be able to respond. And the donation this morning is more in the realm of response, that should there be an outbreak, what is it that we need to do? We need to handle cases. We need to treat people. We need to make sure we clean the water. We need to make sure that health facilities are able to respond to the outbreak. So our donation this morning is in the preparation category, but more to be able to respond and treat cases in case we do get cholera cases in Harare.
And we understand Zimbabwe was last hit by cholera in 2009. Are you impressed with the progress made by the country so far?
I would say yes, although there are still some challenges. Yes, in terms of training people, the rapid response teams are in place. Yes, in terms of sensitization, messages have gone out there and people have been sensitized. The community, health workers have been trained. And as you see from our donation this morning, commodities to respond to the outbreak are being put in hotspots. Although the challenges remain sanitation, which is a big part to control diarrheal diseases, cholera inclusive. So that's a challenge that perhaps is bigger than the health sector, I would say, because we need people to have clean water on a continuous basis, toilet facilities, sanitation facilities. A lot of effort is still needed in that area, but also I want to mention that there are efforts underway both from partners like the wash facilities of UNICEF, where they're trying to chlorinate water, and also trying to see what is it that we can do to have good sanitation in the community and in people's houses.
So can you open, and then Madam Dabiara will hand over to the Permanent Secretary. And this morning, let's see Ms. Maposa what's inside, and then we give over to. Can it be open?
I think they can hand over the box.
Okay.
Yes.
Okay.
The box.
So Maposa, can you assist the Madam Dabiara just to lift it up and then give over to.
You need somebody to you can put it on my head.
No, Ms. Maposa, the camera person want the picture.
Oh, you're strong women.
Ms. Maposa, camera. I think they are done. Shake hands. Strong women, eh? All right, thank you.
Thank you.
So we are going to over to you, Permanent Secretary, for acceptance speech.
Okay. Thank you very much, Director of Ceremonies. And I'll go to the prepared speech from the Permanent Secretary of the Ministry of Health and Childcare. The Ministry of Health and Childcare is grateful for the support which comes in the form of financial, material, and technical from the World Health Organization, as has been exemplified this morning. This support will indeed go a long way in complementing and supplementing the Ministry's efforts in mobilizing critical and essential emergency preparedness and response sources for restocking in our districts and provinces which are threatened with possible outbreaks of diseases. The country is currently under threat of a possible outbreak of cholera, which could be imported from either Zambia, as you have heard, but also other countries close to us, for example, Malawi and Mozambique, which have also been reporting cholera cases. In Zimbabwe, we've already started raising an ultra-high alert in Mashonaland West in Chegutu district, where there are some suspected cases pending confirmation. At the same time, in this country, typhoid fever continues to occur in the city of Harare, leaving us with a more than treble burden to deal with. And typhoid fever has been noted also to spread to other parts of the country due to movements of people in and out of Harare. The situation combined for typhoid and cholera therefore calls upon us to strengthen our surveillance and other measures to prevent and control these diseases. As I said, the ministry and partners are on ultra-high alert for the cholera outbreak, particularly our border with Zambia, where over 2,900 cases and 67 deaths of cholera have already been reported. We are cognizant of strong trade links between us and Zambia, where on a daily basis there are several buses to and from Lusaka carrying shoppers and travelers. There are also hundreds of trucks passing through Chirundu to Lusaka and beyond, and it becomes a matter of concern as these travelers then become a vehicle for cholera importation, and this has been demonstrated in previous outbreaks. So our approach to the current threats: the ministry's National Rapid Response Team will this week be teaming up with sub-national rapid response teams in strengthening surveillance at our borders. And again, this has been facilitated by our support from WHO and other partners. So currently, they are intensifying the surveillance at Chirundu, Kariba, Victoria Falls, and Kanyemba border posts, with a view to ensuring that all our 26 ports of entry, the staff has been put on high alert. Part of the mandate for the rapid response teams at our ports of entry and exit are to ensure that they discuss with subnational teams on cholera screening and detection, orientation of healthcare workers on and other staff manning the ports on cholera and other outbreaks, ensure quantification, mobilization, and pre-positioning of cholera kits and commodities, and also ensure that the messages are disseminated to the communities that can likely be affected. Given the gravity of the situation with respect to the threat of diarrheal diseases and cholera, the ministry, therefore, is issuing a warning to alert the general population and traveling public to take personal responsibility for the prevention of cholera by avoiding or delaying visiting the cholera-affected areas until the outbreak is abated, or else take necessary prevention measures against cholera if forced to travel. The essential preventive measures for cholera include consuming safe food, eating the food while it's still hot, and ensuring that food is bought from reputable dealers or vendors, ensuring that drinking water is rendered safe by treating it at the point of use, and this includes either boiling or using chlorine in the form of water guards, chlorine tablets, or other chlorine preparation. Undertaking basic environmental and personal hygiene, including washing hands thoroughly, always, using soap and running water at critical times. And in the event that anybody suspects they have cholera, they should urgently advise their local health facility so that preventive measures are taken immediately to prevent serious outbreaks that may have serious consequences for the individuals, communities, and the country. So finally, I would really want to take this opportunity to appreciate the support from the World Health Organization, which will ensure that we are kept on top of a possible cholera outbreak, and indeed that we can work towards abating the typhoid outbreak that you have had. Thank you very much.
Thank you very much, Permanent Secretary. Well elaborated, given all tips there, and also the provision the ministry is in terms of preparation. Thank you very much for that. We really want to appreciate, and then also to pass on the word. I think we should have a vote of thanks because we would throw and just close by is not here, but just the WHO offices. So let me call upon the Director, Madam Gerede, to come and give us a vote of thanks.
There are any questions or comments?
Sir.
The media might have some questions.
Yeah, after.
No, I'm saying the media might have some questions or comments.
Okay.
Okay, all right.
And then what I really wanted was Dr. Manangazira, yes, in your capacity as the Director EDC, to explain most times we media, sometimes we misquote or don't understand confirmed cases and the suspected cases. Can you just explain that to us?
Okay.
Just those two words,
Okay.
suspected and confirmed. Sometimes we can say suspected, we say confirmed, yes, it's suspected.
Okay. So thank you. I think it's an important question. In our training in the integrated disease surveillance and response, we always emphasize that this is one aspect of healthcare provision where we love rumors. We actually take rumors very seriously. Elsewhere, people will say, manemakoa. But in outbreak response, we really act on the rumors. If there is a whiff to say there is a cluster of diarrhea cases or something that may potentially be of epidemic potential, we act rapidly and we investigate that rumor. So when we first hear of that, we call that suspected cases. Even when patients come, we have a basket of criteria that we use to say this is likely to be dysentery, this is likely to be, cholera. But the only time we can confirm that it is indeed cholera is when we have taken a specimen and it has gone to the laboratory, and the laboratory has isolated and identified the bug to say this is Vibrio, cholera, Ogawa, or Inaba, and they do further tests to further characterize that. So that becomes a confirmed case. So I might as well say that in most of outbreaks, all the cases start off as being suspected, and then a few are confirmed. The reason why I mentioned the integrated disease surveillance and response is that it's a WHO framework that allows us to improve on our surveillance, our ability to capture any suspected cases so that we act on them and go towards confirmation. Having said that, sometimes people are more worried to say, so how many cases were confirmed of the outbreak? We, in an outbreak situation, according to our IDSR guidelines, we only confirm the first 5, at most 10 cases. Then it allows us to epidemiologically link any other cases to those initial cases. So in terms of resource use, but also outbreak characterization, we don't need to then go on and confirm each and every case during an outbreak. We just need to confirm a certain cluster of cases and then link the rest to those. And then if it's a protracted outbreak, we might then maybe midway and towards the end also subject a few more cases to confirmation. So there is a distinction between suspected and confirmed, but in terms of importance in preparedness and control measures, both are equally important.
Thank you. Can we put our hands together for elaborate? And before I call you Ms. Gereke, let me ride on this time to invite the media. If you have any question, here is Dr. Masunda, Harare City. Bare. Typhoid, so typhoid. If you have any question, media, you are open. Here is, yes, identify yourself and where you are directing your question.
My name is Charles Angelo. My question is directed to Dr. Masunda and Dr. Manangazira. In case of an outbreak, how prepared are we as a nation? Cholera outbreak, how prepared are we as a nation?
Okay, that's good. Direct to both of them, and then they will complement each other. Any other person? I know media sometimes they meet one-on-one, but if you are free to ask a question, you can. Anybody else? Anyway, maybe they are thinking further. There's your permanent secretary.
Thank you. And thank you for the question, Tamsang. So in terms of cholera preparedness, as outlined in the Secretary's speech, we are on ultra-high alert. We actually ensuring that our border is really tightened in terms of our colleagues in Matabeleland North Province, but also the National Rapid Response Team that is actually on site along our border with Zambia. But in terms of nationwide preparedness and response, I already talked about our integrated disease surveillance and response. And in my earlier remarks, I pointed you to our weekly report. It always reports on cholera. From week 1 to week 52 of the year, 52 or 53 issues, we have always been reporting on cholera as far back as the end of the 2008-2009 cholera outbreak. So, and that entails zero reporting, which means all our staff from the 1,500 plus health facilities across the country that report on a weekly basis are actively looking for cholera cases. And our laboratories also do surveillance in any specimens that they get, just to make sure that there is no cholera bug that goes undetected. So as a country, we are on ultra high alert. But this morning sort of completes that in terms of us then ensuring that we do have the material support to, in the event that we get 1 or 2 or 3 cases, to effectively deal with those cases at all levels of the system. So we are prepared as a country.
Thank you, Dr. Managazira. No, we always work together with the Harare City Health Department.
Right.
And he's going to complement that question. Over to you, Dr. Masu.
Okay, thank you very much. All I can say, I think Dr. Manangazira has mentioned it all. We're working together in the surveillance system to check whether we've got cases or not. And as he has rightly said, our system has been able to show that there is no case of cholera since the last previous outbreak. And as we are gathered here, I think it's also part of the preparation that the Ministry of Health and Child Care is doing with the assistance of WHO in making sure that we have the stocks available. And I think from here, they're going to be pre-positioned in the areas, our provinces, and I think our cities included, so that in the event we do get cases, we can be able to manage them.
Thank you.
Okay. Good morning. Yes, as the city of Harare, we've been experiencing a typhoid fever outbreak since October 2017, and the main epicenter was Matapi in Mbare. But as you know, like even the minister came out on the TV, that Matapi is the epicenter of many activities, including road transportation in Zimbabwe. Our vegetable markets, the main vegetable markets I think in the country are close to Matapi. So we've had cases that have moved from Matapi to other areas in and around Harare, but mainly affecting the western and the southern suburbs in Harare. So far we've managed around 2,400 suspected cases of typhoid, and of these we've confirmed about 150. That's from the beginning of October 2017. We're glad to say that at the moment our cases have been decreasing. We have had a sustained decrease in cases since I think the end of November to date, and we're hoping that trend will still continue. We've had a lot of support from our partners, the Ministry of Health and Child Care, which is our parent ministry. We've had support from WHO, even with these kits that have been availed today. I think they'll go a long way in trying to save lives. As a reminder, we've had no deaths in our typhoid outbreak since the beginning of October 2017. Like what has been presented before, a lot of effort needs to be put, I think, in the water and sanitation in Harare, and we've had a lot of people who are assisting us, including UNICEF and most of the WASH sector partners who are there.
Issues of sanitation remains a challenge in places like Mbare. Do you have any plans to make sure that you contain, especially Mbare?
Okay, speaking on behalf of the health department, I think we've done a lot in terms of managing the typhoid outbreak in Mbare. As of now, I think we have almost contained the Matapi outbreak. We've done health promotion in the area. We have done active case finding, looking for cases in the households. We've done contact tracing, whereby almost all cases, we look for those who are around them so as to see if they don't have symptoms, and if they do, they are managed. So in that way, we limit the spread of the cases, because if we get most of the cases, then we will limit the spread, because these ones will be under medication. As the city of Harare, I think efforts are being made to try and contain the water and sanitation issues. I think there's been a lot of talk, I think, in the media, press statements that have been given from the city of Harare, PR department, and I think efforts are being made to manage those.
Zimbabwe is in the process of preparing for an emergency we've donated to Zimbabwe. Maybe you can elaborate about this donation.
When we talk about preparation, we talk about many things. We talk about sensitization and educating people what they need to do, just like Dr. Posha spoke this morning. But we also prepare to be able to respond. And our donation this morning is more in the realm of response, that should there be an outbreak, what is it that we need to do? We need to handle cases. We need to treat people. We need to make sure we clean the water. We need to make sure that health facilities are able to respond to the outbreak. So our donation this morning is in the preparation category, but more to be able to respond and treat cases in case we do get cholera cases in Harare.
And we understand Zimbabwe was last hit by cholera in 2009. Are you impressed with the progress made by the country so far?
I would say yes, although there are still some challenges. Yes, in terms of training people, the rapid response teams are in place. Yes, in terms of sensitization, messages have gone out there and people have been sensitized. The community, health workers have been trained. And as you see from our donation this morning, commodities to respond to the outbreak are being put in hotspots. Although the challenges remain in sanitation, which is a big part to control diarrheal diseases, cholera inclusive. So that's a challenge that perhaps is bigger than the health sector, I would say, because we need people to have clean water on a continuous basis, toilet facilities, sanitation facilities. A lot of effort is still needed in that area, but also I want to mention that there are efforts underway both from partners like the WASH facilities of UNICEF,